Hi everyone, my name is Elis and welcome to my presentation, Guide to Medicare Coverage Costs and How to Enroll. I'm a content creator who believes in being informative and empowering because I believe that the more we understand, the better we can take care of ourselves and the people we love. My motto is learn more, stress less. Okay, so I choose to focus on Medicare because when my grandparents turned 65, they were very confused about how to sign up and what was covered. And I saw how overwhelming the system can be and realized that many families go through the same thing. Today, I am going to walk you through the basis of Medicare, what it is, how it works, what it covers, and how you can enroll when the time comes. We all know how confusing healthcare can be, and Medicare, it's a whole nother level. And that's why I'm here today, not to overwhelm you, but to help you feel a little bit more confident when the time comes, or help someone else through the process. What is Medicare? First of all, according to Medicare.gov, Medicare is a federal health insurance program primarily for people who are 65 and older. But it also covers younger individuals with certain disabilities or serious conditions like end-stage renal disease. It's managed by the Centers for Medicare or Medicaid Services, or also known as CMS, and is funded through our payroll taxes that we pay through our jobs. Medicare is different from Medicaid. Medicaid is for people with low income and is jointly funded by the both federal and state governments. But Medicare is based mainly on your age or disability status, not your income. This difference is really important, and a lot of people don't know that it's not the same, which when applying to Medicare and Medi-Cal, you need to understand. Okay, so the 4 parts of Medicare, and Medi-Cal has 4 main parts. It has Part A, Part B, and C, and D. These are Part A, Part B, Part C, and Part D. And understanding each part will help you choose the right coverage for your needs. So according to the chart that I just showed you, you can see parts covering something different and the costs varying differently. According to Medicare.gov, Part B costs about $174.70 per month in 2024. And you can find these more on ssa.gov/Medicare. And then Part A from the chart is hospital insurance. It covers inpatient hospital stays, skilled nursing care, hospice, and some home health care. And if you or your spouse paid Medicare taxes for at least 10 years, Part A is usually free. Part B is medical insurance, and it covers outpatient care like doctor visits, lab tests, preventative services, and some home health care. Again, most people pay a monthly premium of about $174.70 in 2024. Part C is called Medicare Advantage. These are private plans approved by Medicare that bundles Part A and B and often include extra benefits like vision, dental, and prescription drug coverage. You enroll in Medicare Advantage through a private insurance company, usually. Part D is prescription drug coverage. It helps cover the cost of medication. You can add this part to original Medicare, or it may already be included in Medicare Advantage plans. To see other visuals and helpful charts comparing all 4 parts, you can visit Medicare.gov, where you'll find visuals and tools that explain what each part includes. This part alone can be a huge relief for families, especially if someone is in or out of the hospital. The cost can be a surprise, so it's good to prepare for ahead of time. Okay, so many people don't realize how vital prescription coverage is and if they need regular medication. That's why understanding Part D matters a lot. And how can you apply or enroll in Medicare? You can do so online at the Social Security Administration website, which is www.ssa.gov/Medicare. There are 3 key enrollment periods to know. First of all, it is the initial enrollment. According to the Social Security Administration, this starts 3 months before your 65th birthday, including your birthday month, and continues for 3 months after. This is the best time to sign up to avoid late penalty, which we are all trying to avoid. Is number 2 is the general enrollment, and if you miss this initial window, you can apply from January 1st to March 31st this year. This might come with a late enrollment penalty. The third is special enrollment, which you may qualify for this if you lose job-based coverage or move to a new area. If you're unsure, Medicare.gov offers live support and help tools to guide you through the process. And I just want to emphasize, missing that first window can lead to a lifetime penalty. So make sure to set a reminder or even mark your calendar. Okay, so if you're helping a parent, grandparent, or even neighbors, this is one of the most helpful things you can pass along. So what is the coverage, cost, and common challenges of this? Okay, so let's talk about what Medicare does and doesn't cover and how much it costs. So we already know this from the previous, Part A is usually free. Part B has a monthly premium, a deductible, and 20% co-insurance for most services. Part C and D costs vary by plan. However, Medicare doesn't cover everything. So you still need to pay for things like vision and dental, hearing aids, and long-term care. That's why many people choose to buy a Medigap plan, which is a private insurance policy that helps cover out-of-pocket costs that Medicare doesn't pay. And if you have a low income, you may qualify for extra help or be both eligible for both Medicare and Medicaid, which can greatly reduce your costs. Here's where things get very tricky. Medicare doesn't cover everything. That's why planning ahead is so important. It's also worth checking your state's website or talking to a local Medicare counselor to understand which benefits are available where you live or wherever you live. Why this matters? Why does Medicare play a huge role in keeping? Well, it plays a huge role in keeping older adults and people with disabilities healthy and financially protected. It gives access to preventative care, medications, and treatments without the high cost of paying fully out of pocket. But knowing to navigate the system can be confusing, and this is why the information really matters. When people understand their options, they can make smarter and healthier decisions. I know this can feel like a lot. It feels a lot to me, but even just learning the basics puts you ahead of most people, and helping others understand, that's one of the most impactful things you do. If you'd like to learn more or compare plans, you can go to these 2 websites. www.medicare.gov or www.ssa.gov/Medicare. You can also speak with HICIP counselors here in California. It's a free service that helps you find a Medicare plan that fits your need. Thank you so much for watching. You can always visit Medicare.gov or call the number 1-800-MEDICARE for help choosing a plan. And remember, learn more, stress less, and Take care of yourself and share this video with someone who might benefit from this. And Medicare doesn't have to be confusing.